Hello, my name is McDonna Watson, and today I'll be performing a head-to-toe assessment. I have a doll here. I couldn't get a volunteer, so I have a doll. I perform my hand hygiene. I have my gloves and I have my stethoscope to, listen to the quadrants and the bowel sounds. Today my patient name is Mrs. Jackson. And I knock. Hello, Mrs. Jackson. My name is McDonna Watson, and today I'll be performing a head-to-toe assessment on you. Could you tell me your name and date of birth? And I check the armband, make sure that I have the correct patient against my EMR. And the first thing that I'm gonna do is check the head. Check the around the head, the back of the head, the sides. Make sure there's no bumps or, any scrapes. Checking for any abnormalities. Check the face, the skin. Checking the neck. Making sure the thyroids and, lymph nodes and trachea are in the correct position. No, jugular veins distension or anything of that nature. I'm checking the eyes for symmetry. Making sure there's, no abnormalities there also. Making sure, the eyes, the nose, and, everything is symmetrical. No facial drooping, no paleness, no abrasions or anything. I check the ears, making sure the ears are okay. There's no drainage, no, anything wrong with the ear canal. I'll check the nose, making sure the nostrils and everything is, symmetrical. There's no blockage or anything. Check the mouth. Check the tongue. There's nothing wrong with the tongue, the tonsils, the teeth and gums, and making sure everything is okay. There's no tenderness in the ear or any abnormalities. Check the ear for drainage placement. Check for symmetry. Everything is, properly placed and everything. Inspect the eyes. The person wear glasses, and everything is okay with that. Then I check the nose, making sure overall condition and, there's no drainage or blockage. Inspect the gums, mouth for moisture. Patient doesn't have any cracked lips, bleeding gums. Check to make sure the patient can swallow and, does the tongue move correctly. When you check in the neck, you check the lymph nodes, you note the size and location, jugular vein distension. You turn the patient's head, make sure everything is okay. We're checking for skin breakdown as well. And hope I'm doing correctly. Then we check the arms. We palpate each finger. Make sure that, color returns when you press each nail bed. Should return within less than 5 seconds. You check for skin tuger. You know, that make sure everything is correct. The hands look the same. There's no skin breakdown, any abrasions. Both the limbs look symmetrical. Normal movements of the limb, abduction and abduction. There's no pain. Have the press on the shoulders. Make sure the patient is, can push back or give some type of resistance. Have the patient squeeze my hands. Make sure, they can have some kind of strength in their hands and there's no tenderness or pain once they're doing that. Now I'm gonna move to the chest. I'm inspecting the chest cavities, make sure there's no bruising, it's symmetrical, no scars. Check for inspiration and expiration, make sure that, is at a normal level. And, how the patient uses its accessory muscles while breathing. Checking, make sure there is no tenderness. I'm going to listen to the sounds, making sure I hear all the hard sounds. Listen on the left, then on the right, then on the left for long sounds, and then on the right also. Does the patient use any tobacco or anything of that nature? Then I roll the patient over carefully onto the back. Also, I'm doing skin check as well, making sure there's no skin breakdown or anything. Make sure there's no bulging of the spine or any tenderness as well. And also doing my sounds. Listen for the sounds. Now I'm going to check the abdomen, making sure there's no bulge or mass, there's no bruising, no tenderness or anything. And I'm going to be listening in the four quadrants, the right, upper and lower quadrants, and the left, lower and upper quadrants as well. I'm going to do my sounds, making sure they're normal. Then I'm gonna listen in both all four quadrants. Make sure, bowel sounds are, normal. And then, you move on to the pelvic area. Make sure the patient can urinate properly. Is there any burning or, any pain during urination or any, when you're having a bowel movement? I'm gonna now check the lower extremities. Checking the lower extremities, making sure that those are symmetrical. Also abduction and adduction. there's no tenderness. The patient, you know, can move their limbs properly. Also check the nail beds for capillary refills, making sure, you know. Also, while you're checking the lower extremities, you check the heels of the patient because, you know, on the lower extremities, that's where, you know, most breakdowns and, you know, any pressure injury can occur. You check make sure there's no tenderness or anywhere on the legs. You ask the patient, if possible, if they're, you know, they can push on your hand. Make sure they have strengthened their legs. You know, make sure there's no pain while they're doing that also. We also check to make sure the patient can ambulate. Ask the patient about their, you know, thoughts and do they have any thoughts or anything of harming themselves or anyone else. And, you know, you make sure when you're done, you make sure that the patient is in a safe and comfortable position. Make sure that they're, you know, covered back up if they, you know, had a blanket. Make sure if they're in a hospital or a nursing home, making sure that they have their bedside table, you know, make sure that they have water, their call light, make sure that, you know, the position that they are in bed is comfortable for them. And I think that's it. I check the head, no bumps, no contusions, no, you know, abnormalities. Check the ears, making sure there's no tenderness, no drainage coming out the ear. Check with the light, make sure that there is no blockage or anything. Check the eyes, they're symmetrical. There is nothing wrong with the pupil and no abnormalities with the eyes. You check the nose, making sure that's symmetrical or any deviations. There is no blockage in the nostrils. You check the lips, make sure there's, you know, not any cracks or any cuts. You check the gums and teeth, make sure there's no bleeding or the teeth is okay. You check the tongue, making sure that the tongue moves normally. Also check the tonsils in the back of the mouth. Then you check the neck, check the lymph nodes, the trachea. You check the chest, listen for the sounds in different quadrants. On the front and on the back as well. You check the upper extremities, the arms, abduction, adduction. You check each nail on each hand, making sure the capillary refills are in normal range. Also, while you're doing that, you're checking for skin integrity, any cuts, any bruises, any lumps, bumps, or anything of that nature. Then you move to the abdomen. You check, make sure there's no tenderness, no pain for the patient. Then you listen in all 4 quadrants for bowel sounds. You also roll the patient over, also doing skin integrity as well. And you listen for the lungs and the sounds in the back as well. Then you ask the patient about their elimination, urination, and bowel elimination, making sure that there's no burning, any, you know, the patient doesn't have a problem with elimination. Then you move down to the lower extremities. You check for any pain or tenderness as well. You make sure that the patient can ambulate, move the legs. You check the nail beds on each leg as well, making sure the capillary refills. You also check, when you're doing the lower extremities, check the heel of the patient for those that are in bed, making sure there's no pressure injury there. You roll the patient over, check, the back of the legs. You check the buttocks area as well, because the coccyx and all of that. Make sure there's no abnormalities, no pressure injury or anything. And as I stated, you make sure when you're leaving the patient, if they're in a hospital or nursing home, that they're in a safe bed position, that they have all the necessary things that they need, their call lights, their bedside table. Ask the patient, do they need anything else before you exit. And of course, you perform hand hygiene after you're done. Remove your gloves and perform hand hygiene, and you document. Thank you. This was my head to toe assessment.